Let's be honest. When it comes to men's health, there's one question that creates more anxiety, guilt, and confusion than almost any other. Does daily masturbation harm your prostate? You've probably heard conflicting information. Some people say it causes prostate problems. Others claim it prevents them. The internet is full of myths, half-truths, and outdated beliefs that leave men wondering, am I doing damage to my body? I'm Dr. Madison Li, board-certified urologist with over 12 years of experience treating prostate health. And I've had this exact conversation with thousands of men. Some embarrassed, some worried, all deserving honest scientific answers. Here's the truth that might surprise you. Daily masturbation creates measurable changes in your prostate. But these changes aren't what most men think. Some are actually beneficial. Some are neutral. And yes, in certain circumstances, some can be problematic. If you've ever worried about frequency, felt guilty after masturbating, or wondered if you're doing it too much, drop a yes in the comments. Because today we're separating fact from fiction with real science, no judgment, and complete honesty. Stay with me until the end, because understanding what's really happening in your prostate could change how you think about your sexual health forever. First, let's understand what actually happens to your prostate during and after ejaculation. Your prostate is a walnut-sized gland that sits below your bladder and produces about 30% of the fluid in your semen. During arousal and ejaculation, the prostate undergoes several physiological changes. During arousal, blood flow to the pelvic region increases dramatically. The prostate swells slightly as it fills with fluid and prepares for ejaculation. During ejaculation, muscular contractions in the prostate and surrounding pelvic floor muscles expel prostatic fluid forcefully. This is accompanied by contractions of the vas deferens, seminal vesicles, and other reproductive organs. After ejaculation, the prostate gradually returns to its baseline size. Blood flow normalizes. Hormone levels shift temporarily. When this happens occasionally, a few times per week, your body handles it effortlessly. But when it happens every single day, certain patterns emerge. And these patterns create specific changes in prostate tissue, hormone levels, and overall function. Let's break down the actual changes, backed by real research. Some will surprise you, some will reassure you, and some will require honest self-assessment. Change number 1, reduced prostate congestion. Positive. Biologically, regular ejaculation literally flushes out prostatic fluid, preventing buildup of cellular debris, proteins, and inflammatory compounds. Think of it like changing the oil in your car. It keeps things clean and functional. What the science says. A landmark Harvard study following 32,000 men for 18 years found that men who ejaculated 21+ times per month had a 20% lower risk of prostate cancer compared to those ejaculating 4 to 7 times monthly. Emotionally, this is actually one of the most protective things you can do for your prostate. Regular flushing reduces inflammation and stagnation. Practically, daily masturbation in this context acts as preventive maintenance for your prostate health. Change number 2, temporary hormonal fluctuation. Neutral. Biologically, after ejaculation, testosterone dips temporarily, about 10 to 15% for 1 to 2 hours, while prolactin surges. This is your body's natural refractory period mechanism. What the science says? Studies show that daily ejaculation doesn't lower baseline testosterone over time. Your body adapts. By the next day, testosterone levels normalize completely. Emotionally, many men worry that daily masturbation will drain their testosterone. The research says otherwise. As long as you're healthy, your body maintains hormonal homeostasis. Practically, if you feel consistently low energy, it's likely not the daily masturbation. It's sleep, nutrition, stress, or underlying health issues. Change number 3, improved pelvic floor muscle tone. Positive. Biologically, the rhythmic contractions during orgasm exercise the bulbocavernosus and pelvic floor muscles. Like any muscle, regular use maintains strength and responsiveness. What the science says. Men with regular sexual activity, including masturbation, show better pelvic floor muscle function and fewer issues with urinary control compared to completely abstinent men. Emotionally, this contributes to better erectile control, stronger orgasms, and reduced risk of premature ejaculation. Practically, daily ejaculation can actually maintain the muscular systems involved in sexual function. Change number 4, potential overstimulation and desensitization. Negative if excessive. Biologically, here's where daily masturbation can become problematic. If it's paired with excessive pornography use or aggressive stimulation, the brain's dopamine receptors can become desensitized, requiring more intense stimulation to achieve the same pleasure response. What the science says. Studies on pornography and masturbation show that overstimulation can lead to reduced sensitivity, delayed ejaculation with partners, and even erectile issues. Not from the physical act, but from neurological adaptation. Emotionally, this creates a cycle where real-life sexual experiences feel less satisfying, leading to more frequent masturbation, which worsens the problem. Practically, daily masturbation isn't inherently the issue. It's the intensity and psychological context that matters. Gentle, mindful masturbation without extreme content? Generally fine. Aggressive, porn-fueled sessions requiring progressively more extreme content? That's problematic. Change number 5. Reduced prostatitis. Risk in younger men? Positive. Biologically, chronic prostatitis, prostate inflammation, is often linked to fluid stagnation. Regular ejaculation reduces this risk significantly, especially in men under 50. What the science says. Multiple urological studies show that men who ejaculate regularly have lower rates of chronic pelvic pain syndrome and prostatitis compared to those with infrequent ejaculation. Emotionally, for men dealing with chronic prostate discomfort, increasing ejaculation frequency, with doctor approval, often reduces symptoms. Practically, if you experience pelvic pain or discomfort, regular ejaculation might actually be therapeutic, not harmful. Change number 6. Possible zinc and mineral depletion. Negative if diet poor. Biologically, semen contains zinc, selenium, and other minerals. Daily ejaculation requires your body to continually replenish these nutrients. What the science says. In men with poor nutrition or already low zinc levels, very frequent ejaculation could theoretically contribute to deficiency. However, this is rare and only occurs with inadequate diet. Emotionally, this is where the draining your energy myth comes from. But it's about nutrition, not the act itself. Practically, if you masturbate daily, ensure you're eating zinc-rich foods, oysters, pumpkin seeds, beef, nuts, or consider supplementation. Change number 7. Better sleep quality. Positive. Biologically, ejaculation triggers the release of prolactin and oxytocin, hormones that promote relaxation and sleep. Many men report better sleep after ejaculating before bed. What the science says. Research confirms that sexual activity, including masturbation, improves sleep latency and quality, especially in men over 40. Emotionally, better sleep supports testosterone production, mood, energy, and overall health, creating a positive cycle. Practically, if you struggle with sleep, masturbation before bed might actually help, not harm. Change number 8. Risk of overuse injury. Negative if aggressive. Biologically, aggressive or prolonged masturbation sessions can cause physical irritation, micro tears in tissue, or inflammation of the prostate and urethra. What the science says. Urologists see cases of prostatitis and urethritis linked to overly aggressive or marathon masturbation sessions, especially with inadequate lubrication. Emotionally, this creates pain, discomfort, and anxiety around sexual function. Practically, gentle technique, adequate lubrication, and reasonable duration, under 20 minutes, prevent injury. So, what's the verdict? Is daily masturbation good or bad for your prostate? The honest answer. It depends on context. Daily masturbation is likely beneficial if you're doing it mindfully, not compulsively. You're not relying on extreme pornography. You maintain healthy nutrition, adequate zinc, selenium. Your technique is gentle and you use lubrication. It's not interfering with relationships or daily life. You're over 30 and concerned about prostate health. Daily masturbation may be problematic if it's compulsive and you feel unable to stop. You require increasingly extreme content to get aroused. You're experiencing physical pain or irritation. It's replacing real-life intimacy you desire. You feel guilty, anxious, or depressed about it. You're neglecting nutrition, sleep, or exercise. The key isn't frequency alone, it's the pattern, the psychology, and the physical approach. Here's what I recommend to my patients based on current evidence. For prostate health specifically, aim for 15 to 21 ejaculations per month. Can be combination of masturbation and partnered sex. This frequency shows optimal prostate cancer risk reduction in research. Daily is fine if it fits this range and doesn't create other issues. For overall sexual health, vary your approach. Don't always use the same technique or stimulation. Limit pornography use to prevent desensitization. Practice gentle, mindful masturbation. Occasionally, ensure adequate nutrition, especially zinc and selenium. Use lubrication to prevent friction injuries. If you feel it's becoming compulsive, seek help. Red flags to watch for: pain during or after masturbation, blood in semen or urine, difficulty achieving erection or orgasm with partners, feeling unable to go 2 to 3 days without masturbating, guilt or anxiety interfering with daily life. If you experience any of these, consult a urologist. These aren't moral issues, they're medical signals. Gentlemen, here's what I want you to understand. Your prostate doesn't care about morality, shame, or outdated beliefs. It responds to physiology. Daily masturbation creates real, measurable changes. Some are protective, reducing prostate cancer risk, preventing inflammation, maintaining pelvic muscle tone. Some are neutral, temporary hormone fluctuations that normalize quickly. And some can be harmful, but only in specific contexts of aggression, compulsion, or poor technique. The science is clear. Moderate, mindful masturbation is not just safe. It's likely beneficial for prostate health, especially as you age. But like anything, context matters. Are you doing it compulsively? Are you using extreme content? Are you experiencing pain? These are the real questions. Stop feeling guilty about normal biological function. Instead, be honest with yourself about your patterns. If masturbation is gentle, mindful, and not interfering with your life, you're probably fine, even daily. If it's compulsive, painful, or replacing real intimacy you desire, that's worth addressing. Not because it's wrong, but because you deserve better sexual health and satisfaction. Drop a comment and be honest. How often do you masturbate, and has this information changed how you think about it? Your honesty helps other men realize they're not alone. If this video gave you clarity, hit subscribe for more honest, science-backed information about men's sexual health. No shame, no judgment, just facts. Share this with a friend who needs to hear that frequency isn't the enemy. Misinformation and shame are. This is Dr. Madison Li reminding you. Your body isn't broken for having normal desires. Understanding what's really happening empowers you to make informed decisions about your health. Your prostate health matters. Your sexual satisfaction matters. And honest information matters most of all.